Welcome back to the Socratic Health Podcast, Part 4, Neurodegenerative Disease. Hi, Laura. Can you recap the last episode?
In the last episode, we talked about the third horseman, which was cancer. We talked about the genetic basis for some cancers, but a lot about lifestyle and how we can mitigate the risks for developing cancer, as well as some treatments and really game-changing treatments that are out there for us with on the cancer front.
Okay. It's so interesting how metabolic health has tied everything in together. And Alzheimer's more than anything. I mean, some people call it diabetes 3. Can you talk a little bit about that?
Yes. I'd like to recap this metabolic syndrome. Remember, high blood pressure, high triglycerides, high glucose, right? And central fat, low HDLs. So in a podcast recently that Dr. Attia had mentioned, obesity, central fat, increases your risk of Alzheimer's by 60%. Type 2 diabetes, high glucose insulin resistance, increases it by 50%. High blood pressure or hypertension, 60%. And the same thing with what they call dyslipidemia, which is when your triglycerides and LDLs and HDLs are out of whack. So it's an incredibly, all of those points of metabolic syndrome increase Alzheimer's risk.
That's an incentive to bring down your weight and to lower your blood pressure.
Yes, absolutely. And I'll mention now, but maybe repeat it later, that with high blood pressure, if you remember, one of the greatest risks for cardiovascular disease is high blood pressure. And that the reason for that is that pulsating through the vessels, your blood vessels, causes damage. And remember those potholes, and those potholes then cause plaque accumulation. And if we think about our brain is 2% our entire body weight. However, it requires 25% of all the energy we consume. That energy, that glucose and oxygen, needs to get to the brain through those capillaries. So if you have damaged capillaries, they can no longer bring potentially the nutrients and the oxygen that the brain needs. And of course, that can lead to stroke as well. But you can really see how it all ties together, as you said, the metabolic syndrome and Alzheimer's disease and other brain issues.
Discuss the genetic role, for example, the risk for ApoE genotype.
Now, Alzheimer's is a little bit of an enigma, but we do know some genes that are linked. Now, some are deterministic. But what by that I mean, if you have this certain variant or mutation, you'll get Alzheimer's. Probably the woman who was first viewed by Dr. Alzheimer had an early onset Alzheimer's disease caused by one of those deterministic genes, APP, PSEN. Those names or abbreviations don't matter. But you bring up the ApoE. ApoE is a gene that handles cholesterol being carried through the brain. The brain needs a lot of cholesterol to function. And unfortunately, there's one version of this ApoE gene called E4 that when you have that version, it increases your risk. And you get 2 copies of every gene, right? And if you have 2 of the bad versions, then it increases your Alzheimer's risk by 12%. I'm sorry, 12-fold, not 12%, 12-fold. But that being said, that still is not deterministic. You can incorporate diet and lifestyle changes that can help to mitigate that risk.
Let's clarify dementia and Alzheimer's, because dementia is an umbrella, and Parkinson's disease can fall under that umbrella, as well as Alzheimer's.
that's a great thing to mention here. So first, let's talk about the big umbrella, which is neurodegenerative disease. And Parkinson's and Alzheimer's are both under that umbrella. Now, neurodegenerative, all that means is that over time, your brain cells are going to break down more and more over time. Okay. Now, you can then divide that up umbrella into dementia type of neurodegenerative or motion type. And so, not all diseases that are neurodegenerative change you cognitively. All right. So things like Lewy body dementia, right? Vascular dementia, Alzheimer's disease, they're all impairing your cognitive ability. But things like Parkinson's and ALS and MS, they may not impair you cognitively at all. They might only impair the movement aspect of your health.
But Parkinson's patients can also develop dementia.
Commonly, I would say, is they are more movement than they are dementia, the things like Parkinson's. That's a great distinction. I'm glad you asked about that.
I appreciate the fact that Dr. Attia talks about his anger management issues because on the surface, he seems to have it all. He's a doctor, he's a race car driver, he's a successful podcaster. But in the book, he speaks about how he's had challenges mentally with his anger and how DBT has helped him with very stressful situations. Can you talk about that?
Yes. So DBT is dialectic behavior therapy is what it stands for, but there's 4 modules and really they all have to do with being mindful, right? Increasing your mindfulness. And the first of the 4 modules is regulating your emotions. So talking about Dr. Tia and having these like real having anger issues that he discusses openly in the book. And then of course we're going to get stressed out. The second module is how do we tolerate that stress and dealing with that. Then if how effective are you in your interpersonal relationships? How well do we communicate with those in our circle? What bothers us, what brings us joy, those types of things. And then lastly would be self-care. And it's interesting that in this book, Dr. Attia talks about neurodegenerative diseases and mental health at the end of the book. And it had been shared in an interview that when people read the book, they really said it should be flipped. You should be talking about mental health first, because if you don't have mental health, then none of these other things matter, or you don't care about any of the other things. And so I think it's a really interesting point. And if you were to read this book, any of our listeners, go to the end and read that section, because I think it's really powerful.
One of the reasons why I want to bring it up right after, well, it's a part of the Alzheimer's discussion, even though Peter Attia doesn't have Alzheimer's, but stress plays a major part in how you navigate the world, has major impacts on your brain. So, we'll discuss nutrition and exercise, but also just the mental, your internal world is affecting how your chances or risks of getting a neurodegenerative disease.
Well, and if you think about earlier when we talked about the stress hormone cortisol and what cortisol, it can do to affect our cardiovascular health. And then, like we said, our brain needs a lot of the blood to serve it. And so it absolutely makes a big difference. And I think also being social, one of the things that you hear again and again is finding your people and finding your joy and being interactive with other people. And that is so linked to your mental health.
And that goes straight to the DBT, having good interpersonal skills.
Yes, absolutely. And maybe something that we'll talk about in the future might be a little bit concerning when people become more and more isolated as they become older, but also the younger generations. they're isolated playing video games and being indoors, and I think it's something we really need
And
to
because of COVID
consider.
too, that had an impact.
Yes.
Okay, what does Peter Attia mean when he advocates for data-driven preventative approach?
Yes, I think he wants to see the numbers, of course, right? Or the data. And we're also individual. And what often, if you just check a box where, okay, your blood pressure is this high, you're prescribed a certain medication, but Dr. Attia wants to see you as a whole person, and he wants to know lots and lots. He wants metrics like crazy, and those metrics help him to really evaluate the health of the individual and what treatments and interventions they really need. I love that approach, because we can't just assume that everybody with an A1C of 6.5 should all be treated the same way. And one point that he really makes, getting back to that type 2 diabetes, is why is it that at 6.2 we're going to say you're okay, and we wait until you get to this 6.5 mark and then treat you? No, you're already on the way to getting type 2 diabetes. Why are we waiting for you to fall off the cliff before we have you make changes?
Data-driven wearables like Fitbit is a great way to gather data.
Yes, I love the conversation that I'll have again, like with glucose monitors, and again, the A1C isn't the end all be all. Like, we can see things moving maybe in the wrong direction. Before A1C, we could see whether we're becoming more insulin resistant before we're actually diabetic. And so I love that approach, and I look forward to uh, medicine 3.0, where that's being done more routinely.
Outlive stresses exercises being the most effective neurodegenerative prevention tool. Explain why.
Dr. Attia and others say that the most powerful tool against cognitive decline is exercise. And also that what is good for the heart is good for the brain. One of the reasons is that with exercise, you use up your glucose, which means you need less insulin hanging around, which means you're going to not have type 2 diabetes. But also, when you exercise, you make this growth factor that affects your brain, and it affects the memory centers of your brain called the hippocampus. So it is really not just cardiovascular, but strength training, interval training. All of those things really should be incorporated into our life, because it is the most powerful tool we have against AD.
And obviously, sleep is getting a good night's
Yes,
sleep
and
is
it's critical
critical.
on so many levels, but also when we don't sleep well, our glucose levels spike. Yes.
Oh, that's interesting. Okay. I want to talk about two studies that were done after the book. And the reason why I want to discuss them, they both deal with Alzheimer's. Speak about the Harvard
Yes, sure.
study
So
first.
this was a study published in Alzheimer's Research and Therapy. And they do caution us that it was 50 people, but only 50 people. But they tracked these individuals for 20 weeks. And they did a couple of things. They gave them particular diet. Their meals and their snacks were provided. They gave them some what they called cognitive boosting supplements, and they exercised aerobically 30 minutes daily, and also 3 days of strength training a day. And the last thing, a week.
A
I'm sorry, a
week.
week. Yes, a week. And then they also were part of support groups, right? They had regular support group meetings. And then what they did was they measured that beta amyloid protein. So Alzheimer's is caused by this beta amyloid protein clumping up and becoming a plaque, and that plaque disrupts communication between your neurons, the cells in your brain. So they were actually able to measure that, and were able to see a decrease in the amount of that plaque with this intervention over a 20-week period. So they, of course, are looking now to expand it to more people over a longer period of time, but it's really promising to to recognize
Very exciting.
it's possible to reverse damage that might already be there.
Okay. How about the Lancet Commission?
In the Lancet Commission, there are so many points. Like you said, there's 18 points, and a lot of them are what we talk about, like sleeping problems and diabetes, low social contact. Uh, Hearing, very interesting. I mean, mild hearing loss increases your risk by your relative risk by 90%, and severe hearing loss a 400% relative risk increase. Yes, that is really very interesting. And of course, smoking, obesity, depression, physical inactivity. So you're right. You could take these and divide them up, and they would really fit into all the different suggestions that Dr. Attia has made in the book.
Laura, this started out as a project to review Outlive, but it really I think is a great summary of the book. And you've given your expertise and insights in a very unique way. And is there anything else that you'd like to say about the book and about reading it and the big takeaways?
Yes, I'd say the takeaways is there's so much that's in your control. Don't think that just because you have a bad gene here and there, that's going to determine the course of your life. We've learned in this book and in a lot of other research that lifestyle changes have a huge impact. And what I would also say to younger listeners is think about the cumulative effect that poor decisions are making early in your life. You don't feel it yet when you're 20. Oh, I can do this and I feel fine, right? But you're causing little bits of damage along the way. So I would say, or I would love to have younger audiences listen to this so that they can start to make changes earlier on and hopefully live to 100 years old with a completely healthy lifestyle.
Amen to
Yes.
that. All right. Thank you very much, Laura.
Thank you, Susan. Look forward to our next episode.
Thank you for joining the Socratic Health Podcast for this 4-part series on the book Outlive, The Art and Science of Longevity.